Russ from Pilates Guy. I've created this video today for you to test the mobility of your spine. So the way the back moves is obviously really important for our general well-being as well as our sports performance. This is more of a general everyday well-being set of spinal mobility tests and one spinal stability test and core strength. But if you are struggling with any of these, it's going to impact your sports performance as well as your general well-being. So there are 6 tests. 5 of them are mobility, and the one is core strength and stability, as well as a bit of a postural element to it as well. It should be quite quick for you to work through these. So let's see how you do. The first test that I'm going to take you through is a rotational test. So what I actually want you to do is stand with a mirror directly behind you. So if you imagine this, this would be a mirror. And then what I want you to do is to stand up nice and tall in front of the mirror. So from here, we don't want hips to move at all, okay? So arms are stand by your sides, standing tall in neutral spine, and just rotate around your upper body, and you should be able to turn and look at yourself in the mirror. And then come back to the middle, and then we'll go the other way. And you just want to see if you can rotate around and quite easily look in the mirror either side. If it's a really big mirror, then that's kind of cheating. So we do want to kind of make sure that we are having to turn quite a way around to look at that mirror, sort of looking directly into that mirror. So don't let your hips move at all. And we're just testing that rotation of the spine. Okay, so that's the first test. If you do struggle to look into the mirror, if it's particularly uncomfortable, then you do need to work on your rotation, particularly thoracic rotation. The next test that we're going to go through is our lateral flexion extension. This is side bending exercise, so how the spine moves from side to side. So you're going to stand up nice and tall, again in your neutral spine, fingertips just on the sides of your legs. We do want some core engagement here. And I want you to just slide your fingertip down your leg towards your knee. And you should be able to get your fingertips to the knee, to the side of the knee. And we do want to make sure that's the same on both sides, because as with anything, things can be very different from one side to the other. Okay, so we just want to see if we can get our fingertips to the knees, and we do want it to be the same on each side. If ever those things aren't the case, then you probably need to work on that lateral flexion and extension, side bending movement. When we're doing this, again, like the rotation, you're keeping your hips absolutely still. We're not pushing the hip out to the side, so that makes it quite easy. Hips are fixed in place, knees are soft, legs are relaxed, and you're just going directly sideways like you're between 2 panes of glass, so you can't lean forwards, back, or rotate, and you're just checking how far you can go. The next movement we're going to try is some flexion of the spine. So we're going to do a roll down, and this is kind of seems like a typical touch your toes exercise, but it actually is a good measure of not only the tension in the muscles of the backs of the legs, which is a sign that we need to do something anyway, but also how much tension is through the spine and how much our spine can actually move. So with our roll downs, we stand up really nice and tall. So we're not just bending over and touching our toes. We stand up nice and tall, and what we're going to do is peel our spine over towards the floor. So it's a peeling motion. You do need a bit of core engagement here. We need legs straight but knees soft. We're going to take a nice deep breath in. And as you breathe out, you drop your chin to your chest. That starts the peeling motion. Then we're going to let shoulders slide forwards and your arms just hang. If you've got any issues, any injuries, you may feel you want to keep your fingertips on your legs just for a bit of support, that's fine. But otherwise, just let your arms and your head hang. And we're going to peel our spine over. You're trying to tuck your tailbone under a little bit to begin with. You'll feel a bit of a stretch in your back. But we want to feel that stretch through the spine. We're trying to C-shape the spine. We're trying to peel the spine over towards the floor. And you just want to see how far you go. In an ideal world, you're going to get your fingertips to your ankles, your feet, or even down onto the floor. Okay? And a nice deep breath in at the bottom. You've still got your core engaged. Breathe out, push through the front of your feet, and start to rebuild that spine. When your hands get to your knees, just tuck your tailbone under a little bit and just start to restack. Just start to unwind your spine. Restacking, rebuilding, and coming back up nice and tall. So really speaking, we want to be able to touch our toes. Sometimes we've got an injury that might be difficult, but it is a good measure of general well-being as well as how well we're doing sports and how much we're going to avoid pain to be able to do that. So that's a good measure, touching our ankles or our toes or even the floor, the roll down. For the next one, we're going to bring it down to the floor. So the next test of mobility is spinal extension. So this, we've just gone forward into flexion. This is going the opposite way, okay, to test that mobility. So we're going to start off lying down on our fronts with those arms either side of the chest. You can start with your forehead on the floor if you like. We just want our legs nice and relaxed. I like to go toes in towards each other, heels relaxed outwards. And you may need just a little bit of core engagement here. We're going to take a nice deep breath in, and as you breathe out, you're going to lift your upper body off the floor. Let your arms bring you up into a cobra, shoulders back and down. Do look up towards the ceiling. Ideally, we want our hips still down on the floor, and we want to feel that we are stretching all the way through our back. Okay, so you're going to feel you're bending through your lower back, your upper back, and through the neck, looking up towards the ceiling. Hips on the floor. If you can do that, arms fully extended, hips staying on the floor, then that's a reasonably good test of that extension through the spine. Two more little tests. One of them is a mobility, flexibility test. The other one is actually a strength and stability test. So we're going to do the mobility test first of all, the flexibility test first of all, more so with this one. So we're going to sit up tall in our good posture with our fingertips on our knees. And from here, what we're going to do is hinge from the waist. So we're going to try and keep a nice neutral spine. And we're just going to run our fingertips down towards our feet. Ideally, we want to be able to bring our fingertips to our ankles or even hands around the soles of the feet, but without bending the spine. So we're trying to keep quite a nice neutral spine tall as we just hinge forwards, bringing the fingertips to our feet. Okay, we should be able to get to those ankles ideally. We don't want to be just getting to here and getting stuck. It links with that, but the stability test that I wanted you to try is to sit tall with those legs out in front of you and to be able to get a neutral spine. So you've got a really tall, good posture as you're sitting on the floor, relaxing your legs, arms just down by the sides, and we're just sitting tall, shoulders back and down, chin tucked, and we're able to sit in good posture when we're sat on the floor with our legs out in front of us. So, of those little tests, if there are any that you particularly struggled with, please do give me a shout, because I'm sure I can help you and just give you a couple of exercises that are going to help with that. The first one was the rotation, so looking around into the mirror without moving your hips. The second one was the side bending, so you should be able to touch your knees. And the third one was our roll down, basically touch toes exercise, keeping those legs straight and just peeling the spine over. And we should be able to come back up and rebuild the spine from that. The fourth one, we did the cobra, testing that spinal extension, trying to keep the hips on the floor as those arms fully extend, and we're extending that spine. And then the fifth one for flexibility, mobility was fingertips going down to ankles as we sit tall. The stability and strength around that center was being able to sit up in good posture with your legs out in front of you. Have a little go at those, see how you do. Hopefully you do quite well. If there are any concerns flagged from doing that, just give me a shout. It's russ@pilatesguy.co.uk, or you can go to my website www.pilatesguy.co.uk. Thanks very much for watching the video. Speak to you again soon.